Deal TV, learn and earn.
A great good morning to you, everyone who is watching Deal TV, Learn and Earn. It's Deal Coffee, and today we're talking about health. We have someone who is going to talk about an app that is going to help you change your life. Mind you, you should know that things have changed. With this pandemic of COVID, everything is going to be digital. However, it's the trend that we are taking, but the advance of the COVID has its blessings that it has accelerated the rate at which we are going to move, so that we embrace the digital platforms. But it's not like even if COVID didn't come, we should be heading in that direction. So let's talk to this lady here and tell us about what this product is about. Good morning.
Good morning, how are you?
We're fine.
Yeah.
So our viewers would like to know, whom are we talking to and what product do you have for the audience?
Okay, my name is Linda Nsababera and I work with an application called GoGP Plus. GoGP, in brief, is a telemedicine app. It's an app that you download from Android or iOS, and it allows anybody, wherever you are, regardless of location, as long as you have a smartphone and you have an internet connection, to have access to medical advice.
Yeah.
So on the one hand, you have patients who need medical advice, and on the other side, you have doctors who are ready to provide medical advice. As a telemedicine app, and as you rightly mentioned, because of COVID has accelerated the growth of telemedicine for a number of reasons, but mainly in the sense that it should be easy for anybody, regardless of who you are, regardless of how much money you have, regardless of your status. You should all have access to at least good quality medical care.
Yeah.
So that's what GoGP seeks to do. We say it is healthcare for the masses, because we want anybody, anywhere in the country, at any time, to have access to good quality medical advice. Yeah.
So like when we look at the situation currently, medication has been expensive.
Yeah.
And then if someone looks at the kind of products that you're bringing, isn't it too expensive for the masses?
No, you see, the thing about technology is leveling the field, right? And what used not to be accessible, we are finding easier ways of delivering to our consumers. So now, if you think about, like how I mentioned, putting a patient in touch with a doctor, there are things that make medical care expensive. Number one is, how soon do you see a doctor, right? How soon do you do that medical intervention? Many of us, when we feel unwell, and myself inclusive, I am a victim of this behavior. When you feel unwell, what's the number one thing that you're going to do? You're going to say, okay, I have a headache or I have a stomachache. Yeah. Last time I had Panadol, I took it and it worked. I'll do the same.
You'll do self-medication.
You'll do self-medication. If you don't do self-medication, what the other thing people will do is they will go to a pharmacy and they'll speak to a pharmacist. Now, a pharmacist has certain medical knowledge, but they don't necessarily have the knowledge enough to diagnose you.
Yeah.
So when you look at telemedicine in its whole piece, what it's doing, it's allowing you at the lowest cost to receive medical advice, so that the next decision that you make is the right one. Okay? So, and sometimes when we talk about healthcare costs, we don't even think about the lifetime of treatment of an illness, right? You probably think from the point you started at the hospital, but there are months before where you've been buying medication and self-treating.
Yeah.
So now what we are looking to do is, if you're feeling unwell, right? If you wake up in the middle of the night at 2 a.m., your child has a high temperature. In that very moment, before you reach to self-medicate, pick up your phone, get in touch with a doctor, and let them advise you. And when they advise you, there are a number of outcomes that you can realize through the consultation. Yes. The first one, the doctor can say, okay, based on the symptoms that you've described to me, and remember, the way it works is it's video chat, right? So the doctor can actually see you, and you're explaining your symptoms to him. So the doctor can say, based on the symptoms you've described to me, I can diagnose your illness, and I can give you a treatment plan.
Yeah.
The second outcome will be, you need to go and do these medical tests, and they'll give you a list of tests, and you can go to a laboratory and you can do those tests. And then you can come back and consult with any doctor, right? Because it's all about interpretation of results. The third may be, based on what I'm actually seeing, I need you to go into the hospital. So you see, by the time you then make that journey of incurring your medical expenses, you know exactly what end result you're going to get. We're no longer leaving it to try and error, right? Yeah.
So from what you said, like I could be having previous illness where I have previous results, maybe for that I got. So how do I get this? Because most of the people, they don't understand this medical language.
Yes.
So how do you have option of availing this information to the doctor? Do I have to? Can he or she read from the video, or there is a way where I can send a PDF or what? How do you?
Okay, so now let's go through how the application works, right? So you go on your phone, you make a consultation, right? And pay via mobile money. Now, it will take you by default into a video chat. While you're in the video chat, you'll explain your symptoms to the doctor. What the doctor will do is they'll guide you through a self-examination, right? So that you'll say, I have a headache, I have a sore throat, or my arm is paining. So he will guide you. He will say, okay, fine. If you have a sore throat, can you reach under your chin, this side of your neck, and press? Do you feel anything? Right? You can do that. Or let's say, for example, you have a rash, right? You can use your phone, take a picture of the rash, and send it to the doctor. So you and the doctor have this this journey, because sometimes I think what happens, and the best way I can explain this is using me as an example, because it's my lived experience. When I go to the doctor, many times I rely on him to understand what I'm telling him. So I'll go to the hospital like with one of my kids, as you've seen, and they'll be like, when did the temperature start? I think it was at 2 a.m. And then you gave Panadol. I gave about 5 mils, and how did they respond? What was the temperature like and stuff and everything? So in that space, you haven't got the facts of the illness. Yeah. But in that real time, if it's 2 a.m., I can pick up the phone, speak to a doctor. He'll be like, okay, fine. What's the temperature? Measure the temperature. I measure the temperature. He will record the information. He'll take doctor's notes like they do in a clinic. And all your medical information is contained on the app as well. So you also start creating a record of your medical consultations. And that is your record. So if you go to another hospital, right? Like let's say I actually need to go into Nakasero Hospital. I can bring my whole entire record, off my phone. It's on my email, and I'll present it to the doctor. So even me, it empowers me as a patient to take control of my medical information. And just to highlight the importance of us patients owning our medication, I'll share a personal story. My oldest daughter had to be delivered early, right, at 37 weeks. The doctor didn't want me to go to term because I had a condition called placenta previa. So in the course of discussion, when I was 7 months pregnant, the doctor said to me, you know what, let's schedule, right, on this particular day, and let's have the baby then. So in terms of, I was looking at her and I was like, really, is it that risky? And she said, listen, if you go into labor, because once you're 37 weeks, you can go into labor anytime. If you go into labor and I'm not available, nobody has your medical information. And that is how you will die. I don't trust you to actually remember that you have these conditions as well. So part of the benefit about telemedicine is empowering you as the patient to take control. Take control from understanding your symptoms, being able to communicate those symptoms to the doctor, because the doctor can only, whether you're in a clinic or you're virtual, the doctor can only diagnose you based on the information that you tell them, as well. And the best way to get that information is right in the moment when it's happening to you, right? As opposed to, I'll go 3 days later, then you can't remember what happened 2 days ago.
Okay. Then how do you address the issue of security of the records of the patient? Because I'm sharing to my personal information to your platform. Is it safe?
Yes, it's safe. I mean, this platform was developed in the US. That's where it is domiciled. And it has one of the toughest privacy laws and one of the strongest medical privacy laws in the world. So we are bound at the very minimum, right? That's our minimum level, right? So whichever country we are actually operating out of, right, you're going to find that whatever privacy and data and confidentiality laws are, they are aligned with the international practice, which is what we comply with. And the medical information is actually yours. Yeah,
So when we look at the problem that we have in here is that the ratio of doctors to patient ratio is a problem where we're having less doctors and more patients.
Yeah.
And we are looking at a product that is working 24/7.
Yeah.
So do you have enough doctors, or you employing even doctors from other countries that are working on the platform?
Right now, we have the ability to do that, but right now we are employing only Ugandan doctors, right? And it's interesting that you talk about the doctor to patient ratio. I was speaking to a gentleman who works in the medical field, medical insurance, and he told me that what they have discovered over the years is that you find hospitals are packed with patients.
Yeah.
And many of them, it's a sore throat, it's a stomach problem, it's a rash,
Which are like minor.
Which are like minor issues. And so a lot of money, like let's say in terms of when insurance companies are paying out, a lot of money, a lot of effort, a lot of time is spent treating those minor illnesses. And less time is given to those other more complicated issues when they actually hit us as well. So now by taking an approach of prevention, number one, because the very first step in terms of dealing with an illness is preventing it.
Yeah.
But also early intervention is important. So you can have a 15-minute consultation with a doctor at any time. And even then they work, on their downtime, right, as well. So in that way, it can then free up the physical facilities to deal with the real complicated issues that require your doctor to actually give you time. Because he's not rushing, he's not concerned about if he will make the number of hours he needs to get paid, as well. So it's really about also doctors availing them, because sometimes they find themselves, downtime, right? I'm not engaged, I don't have a clinic to go to at this particular point, but I can provide medical services to people. So in a way, that's what telemedicine is about, and these technology solutions are about. It's about pushing services with few professionals, but delivering them to more people.
So when we look at these products, these are new products that haven't been here or not familiarized with the different people. So how has been the perception?
It's been a learning process for all of us who have been involved, right? I think in my other areas of work and working with different technology platforms and rolling them out in the country, especially when technology is coming from abroad, there are certain assumptions that people make, right? So it has been a very interesting process we've gone through. When you speak to people, they are excited about the option of being able to access a doctor in real time. But what we've discovered is people are used to going to a doctor. Even the most educated people, when you're telling them that there are ailments and there are illnesses that you can manage from home. I was reading a paper of, because the healthcare system, if you pay attention to the world, especially in this time of COVID, they're talking about how the healthcare system globally has become unsustainable, because it's just getting too expensive to treat people, right? So part of the solution some American companies are doing is there are ailments that insurance will no longer cover. So you go with a sore throat, you go with a stomach problem like food poisoning and stuff. The hospitals are not going to handle them under insurance, because these are now conditions that you can actually handle at home. So the process is we're going through a behavior change, both on the sides of the patients to trust a process that is remote, where you can say, I can see somebody from far off and get the same level of care. And even the doctors, we are trying to educate the doctors that, listen, now you don't have a patient in front of you. How do you treat them? How do you diagnose them? Now, again, like I said, I always speak from a position of personal experience. One of my daughters is asthmatic. So she got an asthma attack in the course of while we were piloting this thing. So I said, okay, fine, I have a doctor on the other side. So I picked up the app and I called. And once a child is asthmatic and once you enter into a hospital, there are certain protocols they must follow. And the doctors are used to those protocols. So as soon as I told him, she's had an asthma attack and this is how she's presenting, he said, do you have a nebulizer? Because every hospital has a nebulizer. But her condition is not that critical that I have a nebulizer at home. So I was like, listen, I don't have a nebulizer. I'm going to need you to give me a solution that doesn't require nebulization. So he thought about it, and he looked around, and then he gave me a treatment plan. And it actually worked. Now, this is the interesting thing about that whole entire process. If I had gone into a hospital, I would have spent at the very minimum 120,000. Do you know how much I spent? 17,000. 10,000 shillings on the consultation fee, which you pay on the app, and let's say 5,000 shillings to drive out, go and buy the medicine off the counter at 2,000 shillings. And then I'm done.
Okay.
Right?
So, like when you look at the situation here, the COVID is a problem, our pandemic that we're having, but we're having that people are suffering due to lack of access to medical facilities. Because, like when we are in lockdown, cars are not moving, someone can have an attack somewhere else. But then when you look at this product, it's looking at people with smartphones.
Yes.
Maybe there are areas that there are no data connection.
Yeah.
So how do you address someone like my grandpa or my grandmom down in Chana Mukaka who has maybe a small grandchild that can call?
Yeah.
So have these people been catered for?
Yes, it's in the plan of how we're actually going to roll out, and you will deploy. You see now, look at mobile money. Okay, and people used to ask and say, what about that mother who can't read those instructions and they can't follow those instructions and stuff? There came a solutions. Those mobile money agents that you see around who can actually provide those services. Yeah. So somewhere down the road, we will have an opportunity, and working very closely with pharmacies, as an example, or small clinics, whereby you can put an option where somebody, and it's very interesting. Like when I think about people who, they call us the sandwich generation, right? Because we are taking care of young kids, but we also have aging parents, right? So between all that, so now, like you said, I have a parent who is down in Kisoro, and she just needs to come to Kampala to see a doctor maybe for an hour. Yeah. So I, as a child, in the first instance, will try and facilitate them with the phone. But for those who don't who can't do that, there'll be a solution. There'll be options. I will not go into it in detail, but we will deploy models across the country that will ensure that anybody can actually access, and you'll have people, just as you go to a mobile agent and they can help you, you'll have those kind of services going on.
Okay. Then let's talk about the pricing.
Yeah.
How much do you charge? And then for which are there grades for the doctors?
Yes.
And then how much is?
Yeah. So like you had the name, it's GoGP, and so GP at the end is for general practitioner. So that is the usual doctor whom you see, unless you have a very specific illness that requires a specialist. So to see a GP, you pay 15,000, and then to see a specialist, you pay 30,000, and all that can be done via mobile money, whichever mobile money platform that you're on, and also by card. Yeah, as well. I think somewhere down the line, we want to move into other areas like other payment mechanisms like insurance and advanced buying of services. But yes.
Okay. So when we look at our people, the saving culture is bad. Most of people don't have daily earnings. Is there an option that people can save with you? Maybe they can get like you create where people can maybe have an account. I deposit maybe 1,000 weekly or 10,000 monthly, so that when I don't wait to when I get a problem, I can get the services.
Yes, actually, what happens is once you create an account, you buy credits. Yeah, so you can buy credits as you go along. So you can keep topping up your account as and when. So what you do is you just top up based on what you have, right? And then there is a process in the app where you can convert what you have in terms of your mobile wallet into credits. And it's those credits that you'll need to see a doctor. So you need one credit, I think, to see a GP, because each credit is 15,000. And then you will need 2 credits to see a specialist, because it's 30,000.
So the other people who are looking at organic kind of medication, where someone, because most of the problems health problems that we have are not basically to be solved by taking medicine.
Yes.
It could be in relation to nutrition. So do you have all these nutritionists on board, or?
We are growing the platform. One of the areas we are very excited about including on the platform is mental health, right? Mental health, and we are looking at making sure people have a space where they can contact anybody, because I think if you've read the reports, Butabika says it's overwhelmed, and many mental illnesses that people end up suffering require very early intervention, right? You could be there today, you're stressed about, you've lost a job, you need to speak to somebody, but if you don't find that person whom you can speak to, right, the problem continues to grow, because today it's you've lost the job, tomorrow there's no food at home, and then now they've kicked me out of the house. The problem continues to grow and you're not building solutions. So you need these mental health professionals to come in and help you, work through some of those issues. So we have some mental health specialists as well, and yes, the other allied medicine, the other medical services, as long as they are approved and approved by the Ministry of Health and Staff, there is an opportunity to onboard them as well. Right now, our focus has been on medical, physical health, the GPs and the specialists, and mental health with the psychiatrists and the psychologists. But there'll be a proper plan to actually onboard, because what we want to do, like I've said, is promote wellness. So part of wellness is, proactive management of both your physical and your mental health. It's what do you eat? How do you exercise? How often do you see the doctor? As well. That's also part of wellness. Yeah.
So, people, majorly in Uganda, are used to getting sick and go and see the doctor.
Yeah.
But as you said, prevention could be better and less cheaper than what? Treating the disease.
Yeah.
So, have you had avenues of educating these people, the masses, so that they can know, maybe at least to encourage them to do medical checkups, regular medical checkups, so that we can avoid the escalated disease situations?
Yeah, absolutely. And like I said, when you asked me how is it going so far, it's been a learning curve, right? Like I said, and what we have discovered is that education is very important. So as part of our programmatic work, we have had to go back and refine certain things in terms of how the platform works, because we've been going through a pilot phase, right, this past couple of months. And I think within the next 6 weeks, right, we should see a little bit more active, more engagement, because now we understand conversations like this, having real experiences, speaking to patients, allows us now to customize the product, the service even further to make sure. So yes, education is going to be a key aspect of our work, mainly done through digital platforms, our social media, our Twitter, our Instagram as well. People will find information as well.
Okay.
Yeah.
So at DOTV, we are more into getting people employed. We do, as our motto says, learn and earn.
Yeah.
So there are doctors there, there are nurses there that could be having some time off, who could be willing or interested in these products. What do they have to do?
So what the doctors need to do is go to the app, right, and download it on Android or iOS. They'll look for the portal that says doctor. You will submit your application to be considered as a doctor. You have to submit of course, your name, your ID, your picture, but also your medical credentials.
Yeah.
We will take those medical credentials to the Uganda Medical Council, and they will confirm, right, to us that you have a license to practice medicine in Uganda. And once that is done, we approve. And then all you have to do then is make sure you have the app on, make sure the notifications are on. So when the patient comes, a message is blasted to all the doctors who are on the platform, and first come, first serve. Yeah, so as a young doctor, and I think this is a very interesting opportunity if you're actually out there. Like I've said, telemedicine is the way the world is going. The quicker you adapt it, and learn to use it and become very proficient in it, that I can actually see somebody on the other side and be able to guide them and understand what they are dealing with, but also make sure they have the right advice and the right treatment. The better you become like that, the more people want your services. Yeah, the more they will want your services, you can spread. And as we've seen, the world is becoming flatter. You can move anywhere. All of these systems are becoming global. So this for me is really an opportunity, because not every doctor is going to be able to invest in a brick and mortar.
Yeah.
right? And even brick and mortar is becoming unsustainable. Part of the reason why medical costs continue to escalate is because they have to run those premises. They have to pay those salaries, they have to service those loans that they borrow, and that costs a lot of money. And the bulk of the money seems to go in that area as opposed into your actual care. So as a doctor, that is what you were trained to do. You were trained to give medical advice, right? But what I find, and there's a video I watched that was circulating last week of a gentleman in Zambia talking about the education system. And he gives doctors as an example, whereby you come out of medical school and you end up being a distributor for Panadol. Yes, as well. So you're there to sell Panadol or to sell whatever malaria medication the pharmaceutical company has sent to you. But your asset is your advice. It is your brain. And I think it's time for doctors to really go back. And like any asset, you have to protect it. You have to maintain it. You have to improve it. You have to develop it. So I think what telemedicine offers doctors in terms of new opportunities, it's time to really develop. And every single bit of medical advice that you actually give to people. I know doctors for a fact. You're at home, you saw a patient, the patient takes down your numbers. And when patients are interesting that way, you're like, okay, fine, there's this situation, I'll call the doctor on my phone. Yeah, as well. Why not monetize that process? No payment, right? And you're giving it out for free. Why not monetize that process by making yourself available to anybody and everybody who actually needs you? Yeah.
So as we wind up, I want to pose two questions that go. So what has been the challenges in establishing this kind of startup, and then what does the future hold?
The biggest challenge is getting everybody to understand that telemedicine is the future. We are still going through that process, getting patients, the mass public to actually understand that, getting doctors to actually understand that you can actually remotely diagnose a patient, as well. But also getting the stakeholders, government, the regulatory and supervision bodies to actually move as fast as the way the world is moving, right? And certain times what they do is they send you out into the world and they're like, you go, right? And they're just kind of like watching you, waiting for what mistake you're going to make, right? So that has been a challenge, and it has made us move a little bit more cautiously as opposed to aggressively. But like I said earlier, we have now a very firm understanding, of what the market really needs, and in terms of deployment, what our patients, our doctors, but our community is going to benefit from. In terms of the future is medical care. You as the patient in medicine, you're the product. You're the product, because doctors treat you, pharmaceutical companies are sending medicine to you, you are the product. And they're delivering a service to you. But as a product and as a very primary stakeholder, you don't get a lot of say in terms of the way the whole industry works, right? And so this is what the future is going to bring, right? It's going to bring doctors regardless of where you are in the world. You're going to find a situation, and I was speaking to somebody in California. He's based in a doctor who works in, his client rather, is a doctor who works in Cedars-Sinai Hospital, one of the biggest, most prominent hospitals in California. But they see patients from all over the world, And rather than, because you see, the weird thing about medicine is when somebody is critical, when somebody has cancer or requires surgery, the thing is that we put that person on a plane with all the dangers and the risks associated with that, and then we take them for treatment. But what this doctor is saying, no, me who is the well person, I'll come to you. As well. So it's really up to us, as doctors, to get with the program. Get to understand this field. Give me a call. Get in touch with GoGP. I'm happy to provide a free one-on-one discussion with any doctor who has questions to understand what the landscape in the future is. Get to understand, right, as well. And let hospitals go back to doing what they are supposed to do, being areas of excellence, and not dispensing chemists just to give out flu-fade and that kind of thing as well. That's on the side of the doctors. But on the side of the patients, I think it's time for us to become stakeholders in our own healthcare. Too many times we are just passive. Patients, we rely, they're like, but did you ask? You didn't want to know, you didn't want to ask as well. And I myself am a victim of that same thing. Yeah. One time my daughter was in the hospital and she had been given medicine and she threw up, right? So the next day when I took her for the follow-up injection, she was like, yesterday when I came and I was telling her, shh, let the nurse do. She knows what she's doing. It's like, no, I have to explain to her what actually happened to me yesterday. So for me, I'm from a different yes. Yeah, and I'm like, no, the doctors or everybody, they know what they're doing. They have my best interests at heart, and we have no reason to doubt that. They probably do. But we also have to be
to serve you.
Exactly.
You don't have to fear them.
But they serve me. They'll serve me best if I am engaged, if I understand what my illness is, if I can communicate that. Do you have a headache? Where is the headache? It is right here, as opposed to it's somewhere around. Sometimes we do this thing somewhere around here. Or why somewhere the pain is? Or why as if here? But now with the doctor, he will tell you, okay, press. Do you feel pain? Yeah. Yes, I do. Okay, fine. Then he can take that in that immediate point. So the message to people is get involved, get to know, right? Be curious, ask questions. Reach out to us, ask us questions, and let us guide you. Let us provide you with the answers. But this is the way the world is going, and whether we like it or not, the change is upon us. Yeah.
So now as we end, you should take us through the process, how these people can get this app.
Yeah.
And then share the contacts, social media contacts or the telephone, whereby they can contact you and get to be on board.
All right. So to access the GoGP application, go to your App Store on App Store on iOS. If you have an Apple phone, or you can go to Google Play Store for Android and look for GoGP Plus. It's in big blue letters and it has a plus at the end. Download it, create a profile. It's very easy. It's very self-explanatory. So create a profile and then you're ready to go as soon as that is done. And then if you want to get in touch with me, my number is 0751 455 93. Text me, call me. I'm happy to answer any questions that you have. And then go to our social media. It's GoGP Plus. Just look it up on Twitter and Facebook. That is primarily where we actually are, Twitter and Facebook, GoGP Plus. And we'll be there to answer any queries. We really want to answer people's questions. We want to take people's questions. We want to answer them, but we want to guide them as well.
Okay, we can't take it more than that. We thank you for having us on and sharing us with this information that is very vital to our viewers. If you've been able to be with us at this moment, you should consider subscribing, sharing and commenting so that we give you more of the information that you need and deserve. And main Mukwaya Mayanja Yusuf on Deal Coffee. Bye bye.
Deal TV, learn and earn.